What is a vasectomy? Vasectomy is a simple procedure that men do to prevent pregnancy. By performing a vasectomy, sperm are prevented from reaching the seminal fluid during ejaculation, and as a result, women will not get pregnant without the entry of sperm. After a vasectomy, you will still be able to ejaculate and reach orgasm. There are 3 types of vasectomy procedures. The first method: surgical vasectomy. In this type of vasectomy, the doctor makes incisions in the scrotum to access the 2 tubes. Each tube is called a vas deferens and there is 1 tube for each testicle. Your doctor will probably remove a small part of each tube, leaving a short gap at the end of each. Then both ends are burned or tied with stitches. The second method: vasectomy without surgery. The doctor touches both vas deferens that are located under the scrotum and uses clamps to hold them. Then, by making a small hole in the skin and opening it, both vas deferens are taken out, and after cutting, they are burned or sutured or both. You will not need stitches after the operation. The third method: vasectomy with laser. One of the common questions about vasectomy is whether laser vasectomy is a good way to do this procedure or not. The truth is that laser vasectomy has no superiority over common vasectomy methods, and for this reason, its use is not recommended. A vasectomy is not like breaking a kidney stone where high laser power is required. Also, laser vasectomy does not increase the speed of vasectomy in any way. In fact, the methods available in vasectomy are so efficient, fast and reversible that laser vasectomy has no justification. How effective is vasectomy? This procedure is almost 100% effective, but in very rare cases, the tubes will reattach and there is a possibility of pregnancy. Keep in mind that a little sperm can still come out after a vasectomy. Be sure to do other tests to check this so that you can use other methods to prevent pregnancy. Side effects of vasectomy. This method is very safe and does not cause common side effects. But if these complications occur, they can include swelling, bruising, inflammation and infection. These symptoms are not serious in most cases, but if you notice them, tell your doctor. It will not affect testosterone levels, erections, orgasms, libido or other aspects of sex. Recovery after vasectomy. Rest after going home. Rest at least 1 day. You should be fully recovered in less than a week. You will probably feel sore for a few days. Swelling and pain can be reduced by applying an ice pack. You can also wear a scrotum. Temporary vasectomy. In practice, there is no such thing as a temporary vasectomy, and if you are 100% sure that you do not want to have children in the future, it is better not to have a vasectomy. Unlike vasectomy, vasovectomy or the operation of returning from vasectomy is a sensitive and time-consuming operation, and there is no guarantee of its success. So be careful that there is no such thing as a temporary vasectomy. The success rate of vasectomy is directly related to the amount of time that has passed since the vasectomy, and if more than 3 years have not passed since your vasectomy, the probability of recurrence is high and it can be said that you had a temporary vasectomy. When can you have sex again after a vasectomy? Wait a few days and use other contraceptive methods until the test shows that there is no sperm in the semen. Do this test after vasectomy and after 10 to 20 ejaculations. If the results show the presence of sperm in the semen, the doctor will ask you to do the test again in the future. This is the only way you can know if there is a problem. Does vasectomy increase the risk of prostate cancer? The results of research in this field are variable. According to the American Cancer Society, some studies show that men who have a vasectomy are slightly more likely to develop prostate cancer than other men, but other studies have not found such a relationship. The latest findings show that vasectomy does not increase the risk of prostate cancer in men, and this concern should not be a reason to avoid this procedure. Does vasectomy protect against sexually transmitted infections? No. It's best to still use the best male condoms to protect against HIV and other STDs, and have a partner. Golden tips. If you have diabetes, be careful to perform a vasectomy. It is better not to do this at a young age. Do not have sex for a week. In this case, you may have pain and see blood in your semen. Avoid drinking alcoholic beverages because it may increase the bleeding and pain of the testicles.